Welcome to My Best Practice. In this short video, I'm going to show you how an REBT practitioner can use this session note in a very efficient way so that you can focus on the clinical decision making during a session. So first, let me just orient you to some basic information that's kept at the top of the note: the client's name, the date of the session, time of the session. In the middle, we have the services, the CPT code, the kind of service that's provided, and the duration of that service. And the basic billing information is on the right. Now, if we come down, the note's been organized in a sensible way that walks you through the basic session. So the first thing we're going to do is we're going to add agenda items. So we simply come to the Add button here, and I'm going to add my first agenda item, which is going to be to identify a new presenting problem in terms of an activating event, beliefs, and consequences. Might also add a second item. I'm going to review the BC connection. And then if there's time, maybe I'll teach the client some progressive muscle relaxation to help with anxiety and stress. All right, so now I've got the agenda all set up for what I'm going to do. Let's assume I haven't seen this client in a while. It's a new session, so I don't have any homework to check just yet, but we'll go over that later. So if I want to move incredibly efficiently, this session note in My Best Practice actually has a nice little drop down with checkboxes for the REBT practitioner. So I can simply display this, and then I can say, well, I identified an activating event, I did some inference chaining. From that inference chaining, that led me to the critical activating event. I was then able to assess, they're experiencing some anxiety, I got an emotional consequence. When they're anxious, they really seem to procrastinate and avoid social situations. So, established the behavioral consequence. And then I started assessing, well, what are the irrational beliefs that are going on for this client? And so there were a lot of should statements. And I identified a should statement for achievement here. Also some low frustration tolerance, awfulizing, and some self-downing, so this global evaluation of worth. What did I do about that once I discovered that these irrational beliefs were causing these anxiety feelings, these emotion, and the behavioral problems? I went ahead and I disputed the irrational belief with a logical dispute. And then we went ahead and I explained the BC connection, and we developed some rational coping statements together and rehearse those in session. And I can simply click this and remove it and clean up the note. Now, if I want to provide some more detail about the actual emotions and things like that in terms of symptoms, I can do the same thing here with a drop-down checkbox and say, the client reported feeling some anxiety, more specifically some social anxiety, and maybe a little bit of embarrassment. If I thought there might be some symptoms really under the generalized anxiety disorder, I can come down here and say, they also reported some irritability and felt keyed up or on edge. And then once again, I can click this to get those drop-down items out of my way. Now, I next want to move on to assigning some homework. So once again, I hit the Add button. In terms of homework, I might have them complete an REBT self-help form for each time there is an anxiety episode. Might also be a good idea to have them rehearse those rational coping statements. Whenever there is an anxiety episode. All right, so now I've completed the interventions for the note, checked off what symptoms have been done. Now I'm going to come back and look, what did I do in terms of the agenda? Well, I identified the new presenting problem in terms of the activating event, beliefs, and consequences, and I did review the BC connection. I didn't have time to teach progressive muscle relaxation, and I want to make sure that I do that next time. So what I'm going to do is simply move over here to this nice little down arrow, which is going to allow me to copy that agenda item down to next session. And that's going to be carried forward, so I don't need to remember to do that next time. All right, and now I've got their homework already set. So I'm just going to save changes. And now, after completing this session note, let's look what it would be like for our next session. So I can go to our next session simply by going to the calendar, or I can just come to this arrow key and go to my next appointment that's scheduled for this client. As we move forward, the hope is going to be that everything is carried forward so I don't ever have to flip back. So if I look, today's agenda and homework that was assigned last week is already populated, so I don't need to flip back to my previous note. So I didn't get to teach progressive muscle relaxation last time, but I want to make sure that I get to it this time. So I can do that. I also want to add something else. Well, maybe I'll do some psych ed on the sympathetic nervous system and the role it plays with anxiety symptoms. All right, so I've set the agenda. Now I come over to check homework. And so it looks like for homework, see, they did complete the self-help form, but they didn't necessarily rehearse the rational coping statements each time. Well, what I can see is that today's homework compliance was at 50%, but overall, historically, it's been at 69%. If I want to see, though, the details about previous sessions, I can actually get a little more detail by looking at the homework report. And so here's a table of all the dates of sessions with the number of items that were assigned and completed and the percentage calculated there. Now, if I want to move down further, what we didn't do last time, what I can show you now is we can also do ongoing assessment with any metrics that you like, and these are totally customizable. You can pick any that you want, and there are some preloaded ones that you can certainly choose from, but you can also add to this list or edit this list whenever you want. And then you can also choose simply by clicking here which metrics are displayed on the note each week. If I want to get details and actually see how the client's been progressing, I can just click on any one of these. And I'll see a table with all 5 of these metrics displayed and their scores going back to every session. I can also see them displayed as a chart. And this is going to show all 5 on the chart, but if I want to specifically look at just the Beck Depression Inventory, the BDI, I can simply deselect each of these others. And now I can see how they've improved by decreasing depressive symptoms across time through each session. Now this is a chart that's certainly helpful for the clinician, but it's also something that you can show and display to clients, and when clients are improving, that's very useful. It's also sometimes helpful to try to understand if things aren't improving, assessing why that might have been the case or why there was an acute uptick at a certain date, so that you can better understand how to provide coping skills moving forward. So metrics can be looked at that way. They can be shown or not. In terms of the interventions, these are also customizable just as the metrics are. You can edit and change any of the language. If you only wanted, for instance, to use abbreviations, you can do that. If you want to spell everything out, you can do that. If you want to add totally new items, maybe you come up with your own REBT interventions or metaphors or something like that, you can add those as well. And in the last note, we showed you that there were demands for achievement, affiliation, comfort, and fairness, but I didn't want to drill down to the detail of having low frustration tolerance by each of those. But those are also options you can include. It just depends on how much you want to display. You can customize this note any way you'd like. The same is true not only for the metrics and interventions, but also for the symptoms. You can pull in any of the defaults that are already there for existing categories like major depressive disorder, generalized anxiety disorder, or any customizable ones you want in terms of symptoms like related to over-restrictive eating, any emotions you want to list, or any other behaviors like procrastination or perfectionistic behaviors or anything like that. So we can customize the note however we so choose. Now, if we move down a little bit, another option is that you can certainly do the drop-downs and check things off and move through very quickly. But if you want, of course, you can always type in whatever you'd like into the note just as text. So if you wanted to say, I disputed logically a self-downing belief, you can type as much as you like into the note and save it the same way you would with the drop-down checkboxes. Just depends on how quickly you want to move through this and what level of detail you want to provide. Another option, and we want to do what's most comfortable for you, is you can actually open the diagram box, and there's actually a self-help form. And on this form, you can actually use a stylus or your cursor, and you can actually write the activating event, the belief, the emotions, the behaviors, what you did to dispute it, and effective new philosophies. And you can take any notes you like in the margin anywhere you like as well. So we want you to be able to use this note however is going to be most effective for you, so that you're as effective with the client as you can be. So let's just look at the note. Today I did teach PMR, I did psych ed, I can document any of that here, I can document it in the drop-down checkboxes, or I can even write it freehand in the diagram on the self-help form. Now, they didn't rehearse the rational coping statements this last time, but I want to make sure that they do that in this coming week. So once again, I can use this drop-down to simply copy this down into the homework so that it's there for next week for me to check. And while they did complete an REBT self-help form each time, I want to make sure they do that again because I think that's going to be helpful to them. So I copy that down as well, and we just add that. So I hope this was helpful explaining how you can use this note as an REBT practitioner to be as efficient as you want, whether you want to use the drop-downs, the text box, or if you want to write with a stylus, write on a self-help form, you can do that as well. As always, if you have any questions, any comments, or any suggestions, please contact us on our Contact Us page. We always want to make sure that we're supporting you and helping you help your clients, and if we can improve the software in any way that's going to help you to do that, we're open to your suggestions as well. Please be in touch, and we'll talk to you soon.